So if we will get started fairly quickly. So if anyone wants to turn on their camera, they can do. If you're happy to keep your camera off, that's also okay. But the theme of today's webinar is healthcare. So we've got three presenters who'll be talking about various different projects that they're running. So we've got Alison from the ICS in Lancashire, and we've got Simon and Sam from the Environment Agency and UCLan. And I think there's a bit of a crossover towards the end of Alison's presentation and the start of Simon's to do with social prescribing. So I'll leave that to the speakers. I will be recording this this session. I'm just waiting for everyone to join. So that, oh, there we go. I think the recording's already started, which is great. Which means that if anyone needs to catch up because they weren't able to attend, or they might have also got stuck with some tech issues, then we'll put it online so that we're able to attend, able to watch back. So yeah, the way the format will work is we'll have presentation from Alison, then a couple of chance for some questions, presentation from Sam and Simon, any more questions, and then if anyone's got any additional points they want to raise or any any notices or news, then we can do that all at the end. We'll try and get finished for about 1:30. So without further ado, I'm going to share Alison's presentation from my screen, but we will get started. Is that all okay? If anyone who is on camera wants to, they can hear everything like that, it's all good. I'm going to take that as a yes. So
thanks, Sam.
I just need, Harvey, if you could you allow me to share my screen, if that's okay?
Yeah, that should work now.
Oh, here we go. Yeah. Here we go. Can you all see my screen now?
Yeah.
Yeah. Brilliant.
Yeah, we're seeing some of my other slides. If you, I don't know if you want to make just anyway. If I start talking, so I'm Alison Sathyanathan, and I'm the Net Zero Project Manager at the in the NHS. So I work for the ICB, which is the Integrated Care Board, and we work with practices, and that might be GP practices, dentists, opticians, pharmacists, as well as the trusts, and there's about 1,000 staff within the ICB. We're all aiming to get to net zero. And then what I'm going to talk to you today about is there's loads of stuff going on, but I wanted to focus on the things that how we're working with community organisations and other anchor organisations to get to that goal. So we know that climate change is the greatest threat to global health in the 21st century. And obviously, the NHS, we're responsible for healthcare of our populations, but we produce 4% of the UK's carbon footprint. Next slide, please, Sam. So I just wanted to illustrate here. This is sort of a quick pie chart to show how our carbon footprint looks in the NHS. The blue bits is all around our suppliers. We can't really control that. It's not, which is why we've extended our to get to net zero by 2045 for that particular area. But we're asking, so there's new requirements in contracts to ensure that all providers, some of those are community providers, that they demonstrate that they are getting, doing stuff to get to net zero, as we are. The green bits then are what we can control directly. So things like our buildings, energy, medicines, which is different from other organisations, and travel. So we all have green plans. So trusts have green plans, the ICB, primary care, all have green plans. And what I'm going to talk to you today is some of the things I've been involved in. So can we move to the next slide, please, Sam? Okay, so the first example, so there's three within the green part. There's sort of three parts that I wanted to talk to you about. So how are we adapting buildings? How are we changing our sort of buildings within trusts or primary care to get to net zero? So to become more energy efficient and you know, to use the surrounding, the grounds around those buildings. So you've got an example here that's almost completed. So it's Colne Health Centre, and we've been working with Groundworks to develop the rear garden. So before any work was carried out, this was just a piece, well, there's nothing on it, but the important thing was that Groundwork worked with the staff. They consulted patients as well as the social prescribers that worked in the health centre to design this garden that's going to be used for staff, for you know, patients and the public. So there's some examples there of some really good thing that's happening. And obviously the aim here is to increase biodiversity. But in terms of the health benefits, then you know, in terms of the social prescribing, there's evidence out there that if we have green spaces, that staff sickness goes down, and obviously, you know, for the same for patients. So next slide, please. Another big part of our carbon footprint is around cars getting to work, and our staff. So there's a couple of examples here how one of our practices, Tarleton Group Practice, has worked with Active Travel to gain some funding to produce that, to get that lovely electric bike and to improve some of their facilities in the practice. And they're doing some great work. So I don't know whether it's during the winter, but certainly during the summer, they can do practice visits on the electric bike. And obviously that means avoiding the air pollution caused by using their cars. And then just in terms of the ICB, so we've recently gone out to, we've surveyed our staff, we've gone out to staff consultation, because our aim is we want to reduce, the big aim is to reduce the number of single occupancy cars on the road. But what's the alternative? And so we're asking staff, well, would you be prepared to go on a bike, walk to work, you know, car share? So there's loads of initiatives going on. I'm sending, you know, it costs £2 on the bus. So there's no excuses, even if you live like I do, 25 miles from work. So I catch the bus, which does take a fair distance at fair time, but you know, it's only £2 to get him. But one of the areas that we're, in terms of working with our community organisations, there's somebody called Active Cycles who go to tips. They do some amazing work, and they find, because we're such a you know, we just chuck stuff away, don't we? Kids grow up and the bike gets thrown away. But so there's loads of bikes that they found in the tip. There's somebody there that refurbishes them and then they sell them. And so we've set up a scheme with them, fair weather cycling scheme. So over the next 3 months, there's really reduced rates. I mean, you can buy a bike from them, a refurbished bike for £50 for an adult, and I think £25 for a child. So really good sort of links there. And then we work with Lancashire County Council, so they've got an active travel section in a department who sets up, with our trust, has set up a number of events to promote cycling. So it, for example, demonstrating how you can sort of maintain your bike if you've not ridden a bike since you were 12, sort of give you some confidence on riding a bike. And they also fund an app called Love to Ride, which is, again, gives you incentives to ride your bike. So loads of stuff going on. And then the next slide, please. So I just wanted to give you a couple of, now please don't ask me any questions about these because I'm not directly involved in these particular examples, but really exciting stuff that's going off. Now, bear in mind, this is in relation to the third piece around reducing medicines. Healthy people have a lower NHS carbon footprint because they need less medicine and obviously less surgery. Now, one of the biggest carbon footprints that we've done some great work with hospitals is anaesthetic gases. They're something like 2,500 times worse for the environment than carbon dioxide. So got rid of them. We're still doing some work on nitrous oxide, which is still bad, But, you know, what we need to do is make sure that the population, you know, is healthy. And so there's some of the things here support that. So so these are things that are commissioned by the ICB, so funded. And there's Burnley, Pendle and Rosendale CVS, who has social prescribers, which supports and links to community groups. And all this is around promoting health for our population. And their particular focus is health inequalities. Really interesting one that I found out about the other day is Blackpool Citizens Advice, who are actually based in practices, because so many of the people that visit some of the practices there are in crisis already. And so the GP, okay, you know, huge pressures, stress, obviously that leads to mental health. But instead of prescribing, or as well as prescribing sort of antidepressants or whatever, they get directly referred into the Citizens Advice, who will hopefully sort out some of those social issues. And the focus for them is definitely people living in poverty. And then the last point here is Age UK, who have personal independence coordinators working with other services to create personal plans. And that's for, I'm in that category, but 50 plus with long-term complex needs. But if, you know, in terms of loneliness, and again, the focus is around finding alternatives to putting people on medicines that aren't necessarily the best thing for their health. And then just finally, if I've got time, I can keep talking, but I know I do talk too much. So for our future plans, we're currently working with the Chamber of Commerce on some really exciting audits for our GP practices, and we're hoping to roll those out to dentists as well. Destination Net Zero, which gives them a carbon reduction plan and ideas of how they can get to net zero, what they need to be doing, whether it's travel, improving the grass outside there, improving the area outside the building. And then another one is, this is with trusts. So Her Majesty's Prison and Probation Service, looking at working with probation workers to in recycling of walking aids. And then I can't see the one at the bottom.
It says property services developing more green spaces.
I don't know if the lady from property services might have been able to join us later on, but yeah, again.
I'm here.
Oh, hello. So I don't know, Maria, whether you want to quickly mention something. I've probably run out of time, but
I'll be very quick then. So basically, we have a fund to develop spaces inside and outside of our buildings. So we own or run about 10% of the NHS estate in order to facilitate social prescribing. So any community groups or charities, men in sheds activities, gardening groups, we will convert the space, improve the space, ready to suit that charity to help get these in areas where there's areas of high deprivation, ideally. I can give you more information. I won't waste any more time, but just come and ask me questions if you need to.
Thanks Maria. Alison. Thanks a lot. So that's me really, unless anybody's got any questions for me. But we're keen to work. If anybody's got any suggestions, please come to me, you know, email me, and I'm more than happy to. I can't, unlike property services, we don't have any money, sadly, for this sort of thing. But you know, more than happy to sort of facilitate, make introductions, or whatever. Thanks, Sam.
Thanks, Alison. That was really interesting, and yeah, really interesting to hear.
A bit of a quick. I hope it wasn't too quick. I could have obviously kept talking, but.
No, it was it was a whistle-stop tour, but it's really good to hear all the different initiatives that are taking place in the NHS, and especially how the charity sector could potentially get involved in some of those.
Definitely. And that's what I want to try and convince people, that we are, you know, we're really here wanting to work with people, because that's how we're going to get to net zero.
Definitely. Has anyone got any questions or thoughts at this point for anything that Alison's said? Any ideas that have come out of the ideas she's raised? Everyone's on, cameras off, so.
Oh, I've been let off.
Yeah.
Thank you. Thanks a lot.
So I could just add something if you can hear me, okay?
Yes, yeah.
Yeah, I think what struck me a little bit was just the links between health and then obviously travel and things. So travel is the theme of the next lunch and learn. But I think, that's sort of a bit of a metaphor for all of environmental challenges, really, is that, or solutions, I guess, or opportunities, is that actually they are all quite linked together. So, I think that's quite a good message, really, for us, for the network, I guess, thinking about climate action. And it's those small steps, isn't it? It's those choices that you can make in everyday life that actually have a big impact.
And the thing is, every conversation counts, doesn't it? We know that, but interesting. I sort of presented to our ICB the other day, and somebody said, "Oh, I didn't realise that inhalers had such a high carbon footprint, and having a pill is so much less than a liquid paracetamol or antibiotic." But do you know what? It's getting those messages out there, because actually a lot of GPs aren't aware of these things, and so if you challenge your GP, so that's what we're planning on doing. So next time you're in the consult, you're waiting for your appointment, you might see a little video that comes up that says, because we need to sort of put those challenges in. With the NHS obviously is so busy, and it's where those priorities are, and it's getting those messages out there, and we can only do that together.
Definitely. I'm just wondering, Maria, for the point around if any groups were interested in potentially working with yourselves on a site, on a hospital or NHS property, how would you go about finding out what sites would be available, or how much land, or how much work, is there budget available to do this work?
I was going to invite Rachel to answer that question, as she is the Programme Manager for Social Prescribing and has recently just joined the call. Rachel, did you want to answer?
Yeah, more than happy to. I do apologise, guys, because I'm in a cafe and it's very noisy in here. Sorry I'm late. I've just been listening in the background, so hello. Yes, so to answer that question, we're more than happy to pass out our emails. Me and Maria are working quite closely with internal and external space for this next year. So trying to build a pipeline of projects, really. We don't know what our budget is going to be for next financial year. We're hoping it's going to be similar to what we have this year, which we're looking at around the 800k mark at the moment is what we've had this year. I think in total, and this so far this year, we've got about 12 projects or so in flight, so in progress. It just kind of gives you an idea. We do have a very big target of 100 new sites by 27-28. So I'm hoping our budget is going to be a lot higher next year, because that's a lot of sites to get done. But yeah, just going back, Sam, what was the other question?
So how would a group know that their local NHS site or hospital or GP practice was available to be used in this way? Or is there is it just getting in contact with you and explaining what your project does and where you work?
Do you know what, Sam? Sorry to interrupt. Yeah. Probably the best thing is through me, to be honest.
Okay. Yeah.
Because you've got to bear in mind that these guys, they cover the whole of the nation. We're lucky to have them.
Yeah. Okay.
We're lucky to have them here. But so I think probably the start, especially in terms of NHS trusts, then I link in with the green leads within the estates leads within the different trusts.
Okay.
We're doing all sorts of those grasslands. The councils are doing a lot of work around identifying exactly that. It's called the NR. It's got an acronym. I can't remember, but it's about doing exactly that. So we've got a meeting. I've got a meeting with the trusts in July to look at some of this stuff.
Okay.
So please link. I'll be the conduit, and then if it's to do with property services, then I only recently met these guys. So it's all about building up these relationships, isn't it, and sort of finding those avenues, and then I can sort of get back to them.
That sounds really good.
That's all right.
No, that's brilliant. Thank you. So yeah, anyone on this call, if you're interested in this and you want to find out more, you can get in contact with Alison, and then she can hopefully put you in contact with the right people.
Please inundate me.
Yeah, sounds good. Although you might regret that if you've got a flurry of emails. So I think this leads very nicely to our next presenters. So Simon and Sam from UCLan and the Environment Agency are going to speak about their green social prescribing project that they have been running and are running. So yeah, take it away. Do you need me to share slides, or have you got your
slides? Is that all right, Sam?
Yeah, we can do. Yeah.
Rather than me mess up the tech by
doing
it from my end. But yeah, I'll let you do that.
Here we go. Can you see my screen?
Perfect.
Yeah.
Yeah. Excellent. Yeah, we'll try and keep to time, but it's been quite a journey that we've been on for the past sort of year and a half. So there's quite a lot to say. So, but we will do our best to keep it as brief as possible. But yeah, I'm Simon Bennett. So I'm the Senior Strategic Partnership Advisor for the Environment Agency, covering Lancashire. And as Sam said, presenting today with me is Sam Pywell from University of Central Lancashire. I don't know if you want to quickly introduce yourself, Sam.
Yeah, sure. Thanks very much, Simon. I'm the Social Prescribing Unit Coordinator and Mental Health Research and Knowledge Exchange Lead for University of Central Lancashire. Lovely to see everyone here today. Thanks, Simon.
Cool, cheers, Sam. Yeah, so yeah, there's too many Sams, but as Sam said, that we're going to talk to you briefly about our collaborative approach, collaborative projects that we've been working on with numerous other partners linked into looking at developing sustainable models of nature-based social prescribing. Next slide, if that's all right, Sam. So yeah, don't know how much people are aware of that are on the call, but just to cover a bit of detail on social prescription in general. So nature-based social prescribing, essentially the practice of supporting people to engage in nature-based activities to improve their mental and physical health. And those activities include what's known as green and blue activities. So things like walking schemes, community projects, conservation work, etc., etc. And then the blue element refers to activities that are essentially linked to the water environment. So things like wild swimming or coastal interaction, etc. But also including potentially participants taking part in cultural sort of outdoor activities as well. And ultimately, the prescription element of this refers to the fact that it's actually prescribed, so from GPs or healthcare professionals, and in its most effective form as an alternative to prescription medicine, which has been mentioned already. Next slide, please, Sam. So my role within the Environment Agency is all about finding opportunities for the Environment Agency to perhaps do things a little bit differently, perhaps work with people and organisations that we wouldn't ordinarily work with. And one of our key drivers is to look for opportunities to bring benefits to communities and bring people closer to nature. So social prescription obviously is something of interest. So when I started looking at this, I was kind of reassured to find that the 25-year environment plan published by DEFRA, which is what drives an awful lot of the Environment Agency's work, actually recognises social prescription as a delivery opportunity in there. Also in the NHS's long-term plan, and laid out as a government commitment to transforming mental health services as well. So lots and lots of people talking about it in lots of organisations. And whilst we at the Environment Agency can kind of place ourselves in some of these forums and link into that, for me, I was kind of questioning whether that was enough. And really thinking, what are the opportunities to actually use, for want of a better word, social prescription to our benefit, or rather the environment's benefit. So really, we're thinking about the environmental benefits first, and then the social prescription second, which is quite a different way of approaching this. So next slide, Sam. So I began sort of thinking about how we could use social prescription as a delivery resource, which might sound a little bit controversial, but actually it's just really focusing on the doing and the potential activities that could give people, that real sort of long-term satisfaction of knowing that they've taken part in an environmental intervention that could potentially last for generations. So they get that long-term benefit from taking part. And so that sort of started my journey of exploring social prescription through the NHS leads, through link workers. And that's what led me to the introduction with Sam at UCLan. And we started straight away talking about how we could perhaps do things differently, where the opportunities were, but also importantly where the existing challenges were. And the thing that hit me more than anything with those initial conversations was that realization that social prescription is not just about the activities sort of depicted in that picture on the right hand side of the slide. You know, it potentially links to very, very skilled people who would benefit hugely by being able to put those skills to good use. Next slide, please, Sam. So based on that, it really sort of gave me a lot of food for thought of what kind of opportunities exist within the Environment Agency, you know, currently, and there's loads of them. So, you know, things like tree planting, natural flood management, fencing, survey work, a lot of the work we do with Rivers Trust as well, but also potentially some of the mitigation elements to some of our large capital projects. So where we commit to planting X number of trees as mitigation for the development of a flood scheme, as an example. So could social prescription be used as an opportunity to deliver that and bring in the benefits to the individuals along with the environmental benefits from that mitigation work? So I consulted internally and externally, so with Rivers Trust and internally with our sort of capital projects team and departments. And it's fair to say that there was instant support really from certainly to explore the concept and see how that might work. Next slide, please, Sam. So that really, yeah, where on earth to start with this? So really from that point onwards, it's all down to Sam Pywell and the team that we pulled together to initially explore this. So this was all brand new to me, but Sam and the team really just opened the door to me so that, you know, we could start exploring what the current mechanisms were, who the existing partners were, who we should interact with. And we began shaping an active trial, if you like, of an approach to really test these ideas and working with UCLAN on scientifically assessing any delivery that we were able to achieve. But importantly, you know, throughout the whole of the conversations and the process that we've explored, it's the sustainability of the delivery that's really been the key focus, because that's what will obviously keep things moving in the right way and bring funding. So I'm going to hand over at this point to Sam, who'll pick up on the sort of specific detail of the project side of things, and she's obviously been absolutely instrumental in organising and delivering everything that we've done so far and where we've got to. So over to you, Sam.
That's great. Thanks ever so much, Simon. So just to give everybody a really quick update on where we're up to with this project. EP on this screen actually stands for environmental programme. So we've got this commitment to this environmental programme to apply social prescribing as a priority. And as you can see, we're working with rather a lot of partners, both internal and external to UCLAN. All thanks to the Environment Agency. So like Simon said, coming into UCLAN and bringing these questions, bringing these ideas and us exploring it, we've ended up working with quite a few partners. So phase 1 is now complete. I'm just going to share the link to the report that we've completed. And we're now entering into phase 2. So we are entering into a phase where we're going to be looking at actually delivering the social prescribing interventions on the 3 sites. So the 3 organisations that we've been working with, 2 charities and a organisation that has a charitable arm. Phase 1 used underspend from the Environment Agency, and that allowed us to do proper co-production. It's allowed us to really, really slow down and listen to each other. And this is something that is often missed in research projects, being honest. Proper co-production where we're all sat around the table, where we all listen to each other, where we all build whatever we're going to build together as a team. So it's been an absolute pleasure working with all colleagues on this project. And as a result of us pitching to our senior management, we were then able to apply for a PhD. and that PhD is now, I believe the interviews are just about to happen, and that individual is going to start this September, working specifically on looking at a solution or solutions to the sustainability of nature-based social prescribing in Lancashire and South Cumbria. And I think that's that happening, as well as us recently confirming phase 2, and we've had quite active conversations about the potential for KTP, which is a knowledge transfer partnership. So the potential for future research as well. This is really very, very exciting for us. It's a very strong project. Next slide, please. This is an example of a process map that I wrote quite early on into the project. So just to give an example of one site and the potential of what we could do within one site. Just to give a little bit of history, that all 3 organisations and charities that came to us that we're working with actually highlighted the main challenge for them was that sustainability. So they knew that they were going to get referrals as soon as they opened the doors for, as soon as they advertised, they were delivering on nature-based social prescribing, but to actually sustain it when there isn't the follow-through of money from the NHS at this point in time, or from other organisations, they wanted to look at the bigger picture. They wanted to understand what other areas are done. And I just want to thank Annie Wynne and Let's Grow Preston at this point, because work prior to this project involved a lot of listening to community groups, community organisations, and particularly Annie Wynne's experience of Let's Grow Preston really highlighted actually the challenges of getting funding for nature-based social prescribing providers. And that's where it had really set me off on a journey of how can we do things differently, what needs to change specific to Lancashire and South Cumbria, so that we can actually help this grow, help this continue to have structure, because we know it makes massive difference to people's health and well-being, particularly people's mental health. Next slide, please, Sam. I think I'm pretty much at the end now. So just to say, it's really more of a thank you slide, but just to get a grasp on how many partners have been involved. We've got Sabah Iftikhar from Pennine Oaks and the charity 4 Acres, Lauren and Gillian Carlisle from Winnie Hill Farm. We have obviously Simon's here. We've been working with Natural England as well, George Coombs and Jenny Griggs, Sam Marine, who you might recognise as well from Groundwork. We've had the John Muir Trust involved too, and quite a few partners from within UCLan. So just to say thank you to absolutely everybody who's been involved in this. We hope you'll read the report. We hope you'll get in contact with us if you do have any questions. But just to plant a seed that obviously, because this work's continuing and we have effectively 2 active research projects looking at this in this area, if anybody does want to work with us, please get in contact, and I'll leave my message, my email details at the bottom. I hope Simon will do the same. But that's about it. Thank you very much. Thanks, Sam.
Thanks, Sam. So I did see there were some messages popping up in the chat through that presentation. Has anyone got any points before I run through the chat at all? Any comments or questions they'd like to ask? Just don't need to put your hand up. You can just sort of turn your camera on and turn your microphone on and go for it if you want. No, I'll just put myself on gallery to check that everyone. Okay. In that case, I will go through some comments that were brought up. So I think these are for both presentations. So Sharon Summers said to Alison that her presentation was really interesting. A lot of synergies with our Design Hopes project up in Glasgow. I think, yeah, that's already been, they want to connect. So hopefully you guys will be able to connect. Sounds good. And Sabah said that there are a number of green sites we're creating into green blue social prescribing, and would be great to have a discussion as well, Alison. So there's been a bit of a conversation that maybe we can take to the rest of the group as well. So Annie Wynn from Let's Go Preston has said, we are green social prescriber service providers, but we're not funded by social prescribers or NHS to deliver the services that we provide. Where do we get core and staff costs to deliver the services that social prescribers rely upon us to deliver? So Sam, you've said something in the chat, but maybe if you be able to elaborate a bit for the rest of the group who aren't looking at the chat potentially.
Yeah, sure. We know Annie quite well. And just to say, Annie, I've mentioned you in the report to say thank you to you, because it really was conversations with yourself that really helped me understand the challenges that community voluntary and face sector groups are facing. So they are getting, in certain circumstances, they're getting a lot of referrals, but not actually receiving any funding from the NHS. And I think we need to recognise that. We need to hear that, and we need to actively find solutions, because it is such a, I mean, Annie's an award-winning social prescribing provider. You got, is it an MBE? I'm just trying to think of your qualifications.
It's a British Empire Medal, and we were the social prescribing outdoor project of the year 2022. We've just entered again, but
I feel like
it's so frustrating. We're also finalists for the Bieber community business of the year for this year.
Yeah.
But when we speak to funders, they say, well, if you're that good, why aren't the NHS paying you? And it's like, because we can't get through, because we can't find it. Even Preston City Council thought that the money that they give for social prescribers goes to people like us. And it goes to social prescribers. It doesn't go to the service providers.
I think that's what, oh, sorry, Sam.
Sorry, could I just say, just to emphasise that if mental health and mental well-being are everybody's business, then we all have a role and responsibility in this. And this is something that we saw as colleagues in the university, as you know, as a civic anchor. We have a responsibility in this as well to try and find a solution. So forgive me, it's not, I didn't mean to say it's all the NHS's fault. That's certainly not the angle I'm coming from, but actually we can observe a reality, which is the reality of funding at this point in time into social prescribing in this area. But what we can say is the potential for solutions, for future growth, for future collaborations. Sorry, Alison, after you.
No, you know what, it took me, I'm not used to I'm used to use Teams. It took me ages trying to find what, you know, where you put your hand up. Anyway, so it's interesting. So I've been speaking to our sort of social prescribing lead, because I'm really keen and to sort of do some work around this, and it's been identified. So she's done a review across the whole of Lancashire and South Cumbria, clearly identified that we've got a load of social prescribers, but there's a gap in where we can send those people to. So that has been acknowledged within the ICB, and obviously there's sort of work going on behind the scenes there. But I don't know whether I'm allowed to say, but I have put in a proposal for a workshop that will discuss this. Obviously, it's not been signed off or anything yet, but this is exactly because, you know, we have got really limited funding. So, and obviously, I'm just a minion in the ICB. But you know, I'm hoping to have a workshop where we can pull all the community organisations and how we can work more effectively and efficiently together to sort of find, you know, look at solutions, look at different ways of working. But there is lottery funding out there that I don't know, I'm not very good at this sort of thing, but you know, could we do something collectively, collaboratively to get that sort of the national lottery funding to support some of these initiatives and set things up. But you know, but yeah, it is a real challenge. I mean, you know, the NHS is massively overspent, but there's absolute recognition that we need to stop people. The big spend is in the hospitals, in A&E, and we've got to get it back into the community, back to support primary care and community groups. There's so much evidence that you're so effective in what you do per pound. So I don't know if that helps at all.
Thanks, Alison. And I think the lottery fund you're referring to is the Climate Action Fund. Is that correct? Yeah. So I think that is a good, that is a long-term, that's a new fund, new long-term funding. So, and it's all about partnerships. So,
need to submit by the end of this year at the latest.
So we've got a bit of time, but the year does run away from us usually. I can't really believe that we're almost in June. So, Simon, you've got your hand up as well.
Yeah, I was just going to come on that element. Just the consideration the consideration actually of what additional benefits social prescription brings. So that's the way we're looking at it. The fact that environmental interventions can be delivered that bring an environmental benefit is what levers funds from the Environment Agency. It isn't just the social prescription side of it, if that makes sense. So I think for other organisations that do interact with social prescription, sometimes it is useful to turn it on its head actually and think what other things are you delivering that are beneficial that could lever the funds from the opposite direction, if that makes any sense at all. And that's really what we've played on in the Environment Agency. It as I say, it's the environmental benefit that is the thing that will lever the funds.
Yeah, that's a really interesting point. I think you're right. I think, maybe
it's
being
all
a bit more cynical and seeing where we can, what buzzwords we could use, what.
But it's all tied together. Like if we're reducing what medicines people have to be on, that has a massive impact on the environment, on climate change. So we just need to make sure we tie all this together. And sorry, Annie's there.
No, definitely. Annie, you've got your hand up.
I was going to say we've had case studies where patients or clients of ours are no longer on their antidepressants because of the work that we've done. We've had clients that have said that it's our intervention that's prevented them from dying from suicide. So currently our social return on investment is something like £30 for every pound invested. And we're working with the Lancashire South Cumbria Foundation Trust, various pieces of the NHS who are all doing this work and saying, let's bring on the third sector. The third sector is really good at this. But there is this disconnect between social prescribers, the service providers of green prescribing and social prescribing, and it's all just back to front. And I know you said that you were going to put some more work into it and put some more research into it, and it's like, how many other people, how many other departments at the NHS are currently working on this? Can you not just share your notes and then we can just crack on? Because I'm on limited funds now and I've got to start applying for funding. But we do all the biodiversity, we do all the climate. Because of our intervention, then lots of our clients now say, I'm going to recycle more, I'm more aware of climate. We sequestered 1.65 tonnes of carbon just in 12 weeks because we collected surplus food and delivered that had been grown by the allotments. We created 17,651 meals just in 12 weeks. There are other people doing this. I've just gob at everybody about what we do, but there are so many people doing this, and how do we contact you? How do we make sure that the whole of the Environment Agency and the whole of the NHS knows just how awesome the third sector is?
We know. You're preaching to the converted there, aren't you?
So another question, which kind of does link into to what you've just said, Annie. Harvey was saying to, I guess, Simon and Sam, but potentially also Alison as well. What would you like to see as the next steps, and how could this be expanded more widely? So how can we all join together and ensure that everyone does know that all the good work that's going on?
I think just to come in from an Environment Agency point of view, as I say, the funding that's allowed this is through the Environment Programme, and the more we demonstrate the success of this, the more likely it is that more funding will come through that route. But from organisations like yourselves, Harvey, the Rivers Trust and our other partners that we deliver environmental interventions through. I think the fact that, you know, this sort of opportunity is acknowledged within the criteria, if you like, for environment programme projects, it essentially means that, you know, when we submit a mandate that ticks this box, as well as all the other boxes, the chances of getting funding are higher. So as far as the next steps are concerned, I mean, I think having that on the environment programme means that there is just an ever-growing opportunity, really, to approach things in this way. So that's kind of the feed from our side.
Simon, has anyone else got anything to add to what Simon said?
I've got my hand up. Can you?
Chris, yeah?
Yeah, so my video isn't working. So one of the things which the Lancashire Climate Action Network can do is to try to spread the word and connect people up. This is one of the key things that it's trying to do. And most of you here are members of that network. So if there's anything you'd like to get out to the 126 organizations that are now part of this network, then please, you know, do let me know and we can send out a communication.
Thanks, Chris. Definitely, and I know that there is the a event coming up later in beginning of June, which is about climate action as well. Is that correct?
The 6th of
yes,
June,
yeah.
Second Lancashire Community Climate Action Forum.
Yes, yeah.
At UCLan.
Yes.
So where Sam is, yeah.
Are there tickets still available for that? If anyone hasn't joined on, or?
Yes, I'm not too sure if you've joined on, Sam, but Naomi Robinson at UCLan has been sending out various communications. There's going to be another chance next week. I think she's planning to send one out early next week.
Brilliant. So yeah, if anyone hasn't joined and they are interested in attending, yeah, I've booked on, but yeah, there'll be lots of opportunity for networking, connection, hopefully meeting the kind of people that you want to talk about your project or potentially talk about funding opportunity as well. So yes, that should be a really good event too. We have managed to keep, even though we had a little bit of a late start, I think we managed to keep the time. We're approaching the end of coming to 1:30. Just before we finish, I just say thank you to all the speakers today. Has anyone got any other business or any points? I see, Brian Irving, you've just put something in the chat. There's new soil health research proposal at Edge Hill to improve plant and animal and people health and for climate resilience and food security. Certainly, I suppose, do you want to add anything to that, or is it just a sort of call to action to have a look at that if you're interested, Brian? I think you might be on mute if you're saying anything. Hiya.
Yes, it's at the proposal stage at the moment. We'll probably say more at a forthcoming geography conference on water management in June, by which time all the people involved will be finished with marking exams and have a bit more time to spare to it. But the plan is to start a pilot project in Lancashire, get it into policy, move to a national project, get that into policy, and at the same time be nurturing a global project via various partners around the world.
Wow, brilliant. That sounds really exciting. So I suppose, is it just watch this space and keep in touch for when it comes out in June? Yeah,
certainly. And as Chris suggested, come to the LancsCan Facebook page, where I'll be posting about stuff like this every day. Brilliant.
Thanks, Brian. That sounds really good. So Chris has just put a link for the second LancsCan Community Climate Action Forum. So before we finish, if you want to take a look at that, the link's in the chat. Thank you so much to Alison, Sam and Simon for presenting today. Really interesting stuff. And as Harvey mentioned before, our next LancsCan Lunch and Learn is in a couple of months. It's at the end of July, and the theme is travel and transport. So we'll have, I'm not entirely sure exactly who the speakers are. I don't know, Harvey, if you're on, you might be able to confirm, but we will see you there and send out some details before then so you can book on. Thanks, everyone. I think, Harvey, looks like you've taken your mic off.
Yeah, sorry.
Yeah.
So Lancashire Community Transport, and then we're just waiting for somebody else, the final, who the person that it's going to be. But yeah, I'm sure it'll be another great session like it was today.
Yeah, brilliant. Thanks, everyone. Have a nice day.
Thank you.
Thanks all.
Thanks.
Take care.
Thank you.
Bye.
Bye.
Thank you. Bye.